Thanks everyone for coming. It's really exciting to see such a full room for this talk. I'm especially excited because this is the second time that I've gotten to be in this room with Luis Fabiano de Assis. We met, I guess, about 2 years ago at a UN event in New York, and I saw him present on sort of an earlier stage of the work he's going to present on today, and I was immediately enthralled and knew that he was going to be an ally in this movement towards higher quality data in the anti-trafficking field. So it's really a pleasure to have him as a research fellow with the Honda Center here at Stanford, and have him in residence off and on over the year. So a little background on Luis. I guess what I would say, the thing that undergirds everything he does is evidence-based policy. You'll hear in this long list of titles and positions that he holds that that's really the thread that links everything. So Luis is a Brazilian prosecutor and the Chief Research and Data Officer in the Federal Labor Prosecution Office in Brazil. He's also a law and policy professor at the National School of Public Prosecutors there. In his work at the FLPO, he heads the Decent Work Data Science Lab and Data Hub, which is aimed at really bringing multidisciplinary analysis to large data sets, again, to yield evidence-based research, policy, and law enforcement insights. The big data platform that he envisioned, and which he will talk about today, really enables not only law enforcement, but researchers, policymakers, and everyday citizens and practitioners to really address some of these challenging questions around vulnerable populations, and specifically those victims of human trafficking. We work together on the United Nations University's Alliance 8.7 Knowledge Platform Reference Group, which again tries to do all of these same things, but at an international level. And actually we have just launched the first tranche of country data sets on that platform. So if anyone's interested, they can Google the Alliance 8.7 Knowledge Platform. And then also in Brazil, in collaboration with the International Labor Organization, Luis heads the Decent Work Smartlab Initiative, which includes the Digital Observatory of Slave Labor and the Digital Observatory of Occupational Safety and Health. And at the National School of Prosecutors, he teaches in the area of law and public policy. He has 3 degrees, all from the University of Sao Paulo, Brazil, his LLB, LLM, and PhD in law. And some of his current research initiatives, including those he's working on here as a research fellow, including looking at sort of the impact of conditional cash transfers in moving towards victims of human trafficking, investigating health standards such as mortality rates and life expectancy for human trafficking survivors, and also studies supported by supervised machine learning concerning the prediction of risk, vulnerabilities, and law enforcement resource allocation. So please join me in welcoming Luis.
Thank you so much, Jesse. I'm really excited about this conversation today. I'm going to bring you some background information, and then I'm going to talk about the projects and an overview about what we're doing there in Brazil to use data and knowledge to fight human trafficking. As I'm going to, jump to the next slide because Jesse made a very interesting overview about about my work. Well, I'm going to bring some overview about the challenges that we face in Brazil in terms of fighting trafficking. We have a very disorganized ecosystem in terms of scenario to fight against trafficking. We have complex social problems such as poverty, extreme poverty, child labor, a lot of corruption, former president in jail, former governors in jail, congressmen in jail, and this struggle didn't end and will not end anytime soon. We have a lot of political instability. Suffice it to say that over the past 30 years, we had 2 former presidents impeached, Collor de Mello and Dilma Rousseff. And all that in a country with 210 million people is the 5th population in the world, with a highly inefficient bureaucracy. We have a federal state with 27 states and 5,570 municipalities, where most local governments don't know whether what they're doing work and what they are working for. I mean, they're totally lost. So policymaking in Brazil is mostly rhetoric oriented. We have, as I told you, a very disorganized ecosystem when it comes to fighting against human trafficking and other challenging issues. But we have lots of opportunities. Brazil has a big economy, is ranked among the top 10 in the world. We have a very diverse cultural background, multiple ethnicities, and many aspects of developed nations. We have a very sophisticated industry. Our elections are 100% electronic. Our financial sector and payment systems are highly digital. And we live in a highly connected society. The Wall Street Journal a couple years ago said that Brazil is sort of the social media capital of the universe, because people are, people there really like to use the internet to be connected all the time. And we have 90% of the households with internet access, so mostly through smartphones. So the first thing that someone in Brazil buys when they make some money, it's a smartphone. So the smartphones they use to reach job opportunities, to make networking, to find opportunities of survival, I would say. And of course there is a risk that this opportunity ends up in a trafficking situation. So WhatsApp there, it's totally free. So when you get your smartphone with internet access, 90% of the households have, you will be using WhatsApp, and WhatsApp has been used in Brazil. With recently dismantled a group of people who were recruiting transgender to go to Europe and to be exploited there, and the whole thing was being made using WhatsApp and Facebook, basically. Well, we live in a highly digital country with massive amounts of data and statistics being produced, but little strategic information, lack of collaboration between agencies. The databases, every year they keep on collecting data and producing more statistics, but they don't transcend the boundaries of the record keeping. They don't use the databases. What I mean by they, government agencies in general. They don't use the databases to do policy making, to know what's going on, to sort of design the profile of the vulnerable population, and so forth. So we needed a knowledge base to inform the policy making, that knowledge base that could inform the policy making process, not only at the federal level, but at the state level, and most importantly, at the municipal level. So this is why we started the Smartlab Initiative, which is basically a data for good project. We created this decent work policymaking knowledge base. We've started to collect databases from different government agencies and prepare them to be used in meaningful ways. We've cleaned the databases. Most databases we've collected were in PDFs and thousands of spreadsheets we had to reorganize to make the thing seem like something meaningful, right? So one of the main targets we had was to empower the established network of government agencies, NGOs, frontline practitioners, academics, for them to have access to data, information, and raw data in open data formats, for them to do their research and no profits. Foster new information flows. Foster more transparency, more accountability, and more social control. Interestingly, accountability, it's a word that doesn't have a translation to Portuguese, So it's weird, but there's weirdness there in terms of accountability. So, so basically, just an overview, we have collected traditional databases, unemployment, it's hard to read, I'm sorry. Unemployment insurance paid to victims of human trafficking, and I mean by human trafficking, sex trafficking and labor trafficking. Case management databases from the judiciary, from the prosecution, police, inspection, NGOs, etc. And we started to use non-traditional data sources to track vulnerabilities, because this is really unusual. People are not used to do that. And census data, surveys data, academic assessment, for example, we've collected a very interesting academic assessment, which is censitarian, applied to 6 million children, 6 million school children in public schools, which has a piggyback survey where they ask whether or not the children work and for how many hours a week. So this is very helpful. It was a piggyback survey attached to the academic assessment, a public one, but people were not using to track vulnerabilities, to track whether or not and where and when, what kind of work the children were developing, child labor. Public health system databases, migration databases, labor accidents and diseases, information on labor contracts, tax receipts we started to use to map value chains and who's selling to whom, who involved in human trafficking or with its value chain involved in human trafficking, might be selling to whom. So we started to use tax receipts to map supply chains. Information on companies' ownership, satellite imagery, etc. And we were paying attention since the beginning at the cash transfer programs, because we have, and this you might think, oh, Luis, that only applies to Brazil. Only in Brazil you have so much data. That's not true at all. In most countries you have, according to an OCDE report, we have like roughly 200 countries in the world, of which 132 low and middle income countries have a sort of a cash transfer program in place. Some of them with conditionalities, and the numbers are going up. In 1997 there were 2 with conditionalities. In 2008 there were 27, 2015 64, so the number is going up. And in Brazil we have the largest, one of the largest, if not the largest, cash transfer programs in the world, called Bolsa Família, which is a rich database that reaches 14 million families, 15 million people, and it has conditionalities. The payments are made based on conditional on children attending school and receiving primary health care. So it's a very rich database in terms of tracking vulnerabilities, poverty, extreme poverty, the situation where most families are vulnerable to being attracted to fake promises and fake labor contracts and etc. So very important database. So basically what we did was to transform raw data into readily available public information to prosecutors, stakeholders, policymakers, etc., to start doing evidence-based interventions, evidence-based research, evidence-based, develop evidence-based projects, evidence-based policymaking, and results-oriented interventions. Interestingly, everything we did, I'm going to show you in the slides to follow, is open source. I mean, we didn't hire consulting companies spending millions of dollars the government the government agencies were used to spend, and without solving the problem. We didn't use anything but open source technology. Our first experience was, and you might think, oh, you have a huge team in Brazil. No, it's basically me, a personal assistant, and 2 developers. That's it. Our first experience was with the Occupational Safety and Health Observatory, and we've harnessed this first experience to develop the Human Trafficking, the Modern Slavery Digital Observatory. This is the Occupational Safety and Health Digital Observatory that all of a sudden all the frontline practitioners in Brazil started to use, because they have information about more than 5,000 municipalities in Brazil, and they can use information to track the patterns in terms of ICT codes that are more prevalent, labor accidents that are more prevalent in specific location, or what kinds of causing agents are more prevalent, what kinds of economic sectors concentrate most cases of labor accidents and diseases. And they, all of a sudden, Brazilian research institutions connected to the observatory. This was, lots of events and conferences like that, in which we're explaining the observatory and learning from them new opportunities for developing the platform to make them in their daily interventions to be more effective. And then we've used this experience based on the first observatory to develop the slave labor digital observatory, in which we have indicators for all of the 5,570 municipalities in Brazil, It encompasses cases of trafficking, census data, surveys, administrative data. We have sort of created a visual display of the evidence we first found in thousands of spreadsheets. This was basically what we did. If you type in your browser, you will manage to access the observatory. It's observatorioscravo.npt.mp.br. It's publicly available. Well, we are focusing here on three basic perspectives. First, repression, which is the traditional perspective, right? We're focusing on the prevention of hiring with fake promises, and I'm going to explain each one of those perspectives. And we're focusing also on the prevention at the human development level. I'm going to explain each one of those perspectives. We're focusing on holding local governments accountable, as well as state-level governments accountable. Sort of setting the public agenda, nudging the media outlets to talk about it on a daily basis, not only at the National Day for the eradication of human trafficking, for the eradication of slave labor. No, let's talk about the issue on a daily basis. So this is what happened few months after we launched the observatory. This is the state governor of Maranhão, a good partner, Governor Gino, who entered into a cooperation agreement with our prosecution office to redesign the policies in place in Maranhão, to redesign them with an evidence-based approach based on the information we started to provide them with based on the observatory. As we have unprecedented information concerning hotspots, survivors' profile, and vulnerability patterns, the governor and the government can now improve frontline work, improve resource allocation through the network, the social protection network, etc., and to communicate with local NGOs and work with a better resource allocation. So we have this commitment agreement I'm going to talk about in a couple of minutes again. Well, here we have a vision of the map of Brazil, and you see those green dots over there that represent the places where the victims were rescued. So interestingly, if we focus only on the green dots, in this region of the map here, you see the Amazon right here. So the dots coincide, the most prevalent dots coincide with the boundaries of the Amazon. So we see a clear relationship with the places where the victims were rescued with the deforestation and the environmental destruction. So this is important, of course, to improve law enforcement in that region to tackle human trafficking when human trafficking and labor trafficking is happening. But if we explode those dots and create sort of a vision of the red one, the red dots represent the places where the victims were born. So it's a totally different perspective in terms of prevention. We're not talking about prevention when we're talking about repression and law enforcement on the places where the victims are being rescued. We're talking about prevention at the human development level when we concentrate our attention on those dots where the victims were born. So totally different places, totally different perspective. And there is another one, which is the places where the victims live when they were hired. Totally different perspective. We see it on the blue dots, the places where they lived when they were hired, suggesting migration routes, suggesting places of vulnerabilities, not because you were born there, because someone went there and hired you with a fake promise. So three different perspectives. And we started to, for each municipality in Brazil, we have a huge set of indicators. I will walk you through this a little bit in an overview. A quick analysis of the municipality of Codó in Maranhão. Right here, Codó is a municipality in Brazil, in Maranhão, where in most cases concentrates in terms of, three perspectives. People that live there that are attracted to exploitation, people who were born there attracted to exploitation elsewhere in the country. They lived there, they didn't manage to stay there, and they went to other states, so the countries, to other states. They went to other states, and they have been rescued in other states. And Godot is also a hotspot in terms of victims being rescued in the time series. So, interestingly, this is the State Secretary of the Human Rights and Social Development of Maranhão. He's already using your platform based on something's on the screen, right? Okay. So based on the settlement agreement we entered into with the state governor, he put his team, his staff to work based with on a daily basis with the observatory data. And this is the Secretary of Human Rights. Jesse, about the speed, is good? Is good?
Your speed
Okay.
of talking. Yeah. Fast, but it's good.
Okay, I'll try to slow down.
Come on.
Okay, this is the Secretary of Human Rights and Social Development of Maranhão already using, you can see here, this fine print, you're going to see the address of our observatory. And, the same three perspectives, the green, the red, and the blue, right? So the three perspectives, you have to pay attention to Godó e Maranhão, Godó na rota do trabalho escravo, in the route of modern slavery, slave labor. So we have to pay attention, he told his staff, to Godó, not only because it's a place where we find victims. We have to pay attention to Godó to improve social and economic indicators, because people who were born here go to other places to find jobs and are attracted to human trafficking, and people who live here are also being attracted to exploitation. And I'm talking about the Amazon. This is Godó seen from space. And take a look. This is, over the past 20 years, images from Godó and what happened there. Sad, isn't it? Well, so this sort of creates a vision that we can, all of those images create clearly an image of the demand and supply curves involved here, because we have places that attract workers, places that supply workers, right? Well, and this is the rest of the observatory. I'm gonna, just present it quickly here. In analyzing the case of Godó in Maranhão, you're seeing here that the participation of Godó in Maranhão is around 1% of the state GDP. It's really weak economic activity there. 120 people live there, of which 44% are poor and 25% are extremely poor. Interestingly, another thing that I would like you to pay attention to is that here on this spark line here we have the amount of rescues, and this the amount of inspections that took place in Godó in Maranhão, and you see that a large number of victims rescued with just a small number of inspections, and a small number of rescues with a large number of inspections, to make clear that the government is not being as efficient as it should. I mean, you can say, oh, they made lots of inspections and rescue just a few people. Yes. One of the objectives of the observatory here is to show what doesn't work as well. So this is one of the reasons why the governments in Brazil doesn't like us very much, because we're showing not only what works, but also what doesn't work, right? In putting it to out there, the information, so the media outlets can talk about it, and we sort of can nudge the policymakers towards a better policy making. Interestingly, I'll ask you to keep this in mind. This is the number, the HDI in the dimension of education for the municipality of Godó, it's 0.49, which is extremely low for a municipality to have, a human development index in the dimension of education. Well, this is interesting. It's a community, it's a faith-based organization that it's called Pastoral Land Commission, Comissão Pastoral da Terra. It's a good partner in Brazil. It's an NGO connected to the Catholic Church. And they organize meetings to discuss, opportunities to improve their victim care services and the connection between different agents of the social protection network. And in that meeting, we were discussing not only the use of the observatory for them to have better means of planning their activities across the country, but also victim care systems provide them without any cost, open source, for them to better organize their data collection on a daily basis. It's 100% cloud-based, and it has the support of the ILO to make them, to improve to provide them with training to use that platform. Well, I asked you to keep the HDI numbers in mind because this is a program of the state of Maranhão called Mais IDH, which would be more HDI, meaning that they want to raise the HDI indicators of a set of municipalities. Those are the municipalities chosen. And a couple of weeks ago, I've been with the Secretary of Human Rights and Social Development there, and I asked him, which criteria you've used to select the municipalities, right? Oh, he went like, oh, it was the HDI. Okay, but which HDI? Because if you use the HDI, the general HDI, you're gonna end up creating a set of municipalities maybe disconnected to other policies in place and maybe disconnected to the policy that you should be developing based on our agreement, right? Focusing on the municipalities where most victims were born. So we end up realizing that he had used the general HDI when he should have, if he really wanted to use the HDI, he should focus on the educational dimension of the HDI, which would predict way better the vulnerabilities than the general HDI. So one of the problems we have in most municipalities, I'm talking about the Maranhão and the municipality of Godó, is that they sort of use indicators and they don't know what they're doing exactly and why they're using that indicators to predict whatever. They should be sort of having more, should be more careful in selecting the indicators. So in this case here, we have lots of, in the observatory, we have lots of means of selecting, suggesting a set of municipalities that should be tackled first. So we are keeping the conversation going with the state secretary to sort of create connections between different policies in place because they have 7, 8 policies and they don't connect to each other. It's crazy. Well, here, interestingly, we have made some the mapping of the main migratory routes concerning a specific. We have it for the entire country. So this is specifically the municipality of Godó in the state of Maranhão, which appears here as the origin of workers. So it's supplying workers and it's receiving workers as well to work in the municipality. So we have this set of municipalities for different years for the time series to track exactly what's going on in terms of migratory routes. So on your left, you see the places where the workers were born, and on your right, the places where they were rescued. Well, we have more and more information there in the observatory, and you might think, oh, you're only using information about rescued victims, and but the fact is, as we are collecting data on the profile of the victims and designing the profile of the municipalities where they were born, where they were rescued, etc., we can connect different municipalities with the same characteristics. it's not because I've never found a victim of slavery connected to a specific municipality that the municipality doesn't have vulnerable population. So interestingly, this set of indicators we've created, this knowledge bases we've created, allow us to predict what might be happening in a specific municipality about which we have never heard before in terms of cases of trafficking. So this is one of the cases in which we're using machine learning, but we're not. This is really important. We're not using machine learning off the shelf and putting the information there to the churn to work. No, we're sort of embedding domain knowledge to the machine learning algorithms to develop the models in a way that it will predict in a more efficacious way where should be our focus. This is me talking to media outlets and showing them the opportunities they have to issue news at the local level, at the state level, at the federal level, national level. This is Rede Globo, which is the largest TV channel in Brazil, using information here. You see the fine print, the source, it's the observatory. And they're criticizing, they're saying that the government, in terms of counter-trafficking strategy, is doing really a bad job. And we're also, this is a congressman. He's using information based on the observatory to talk about the issue at the early stages of policymaking. So I'm sort of showing you some examples of what we're doing with the, how this sort of new information flows can, without spending a large amount of money, we can, modify a reality. Here we have an example. It's just to mention that we're using a lot of. At first, we started to use municipalities as the most important unit of analysis because they are the most important unit of analysis when it comes to developing policymaking. But now that we have information on our knowledge base on our platform about census blocks, we have disaggregated the municipality to track, for example, places like this, and provide, most frontline practitioners say that they don't have means of reaching informal places and places about which we don't receive many reports, many denounces about. But we've developed in our platform a means of using census data and census blocks, census traits connected to different indicators of health services and of lots of social protection network data that we've transformed into indicators. We're sort of trying to predict where the problems are, and we're using the same approach to detect, to empower law enforcement mechanisms. For example, you're seeing a map in which we have combined poverty indicators, educational indicators, healthcare indicators such as teenage pregnancy, statistical addresses collected in relation to each census block, and I've mentioned teenage pregnancy. Teenage pregnancy, when it comes to dealing with children aged like 11 years old or 10 years old, I wouldn't call teenage pregnancy. I would call rape. But unfortunately, the government call it teenage pregnancy. But okay, knowing that it's about rape, we've used that information, that set of information of different information, pieces of information to find, to find places like this, which is a brothel in which we found children being exploited. And I mean, we're using a lot of new platforms to inform law enforcement for us to reach the problem quicker. And we're also developing lots of platforms to nudge policymakers towards a better policymaking. And one of the things that we're doing is to ask them whether or not they're doing what they're what they pledged to do. So every now and then you go to a conference and a country or a state governor says, we are going to fight slavery with X, Y, and Z. And we see a big company saying we'll improve our social and corporate responsibility mechanisms doing X, Y, and Z. And the next year they promise the same things and everything changes so as everything remains the same. So one of the things that we started to do is to put every single plan in place in Brazil. So we started with the plan of Maranhão, the counter-trafficking plan, and now we have the national plan for combating forced labor. And recently we've received a call from the Ministry of Justice in Brazil, the current Ministry of Justice, who wants to use the same platform to monitor the plan. So what's the basic idea here? All the actions of the plan are divided in general actions, repression actions, prevention actions, victim care, and etc., legislation monitoring, etc. And we ask questions to the stakeholders. And this is the state secretary of blah blah blah. This is the institute blah blah blah. And we ask questions and they answer to the questions. Did you do what you told us that you should be doing the next year or so? No. Yes. No. And most are no's, you know, during the survey. But, well, this is... So we're doing this survey and we want to compile the results and put available in our observatory. The next slide, well, it's pretty much what I was talking about. This was the global conference on the eradication, on sustainable eradication of child labor in Buenos Aires last year, and I was there. In lots of countries, you know, during the conference they were invited to make public voluntary pledges describing, you know, concrete actions that they will undertake or would undertake to tackle child labor. And I'm showing you this snapshot because the basic idea of this platform is to monitor them in relation to whether or not they're doing what they told us they should be doing. Well, this is me again in Lima, Peru. ILO invited me to talk, you know, to make the same presentation I'm doing here to Latin American countries and to tell them how they could, you know, use the data, the available data they have to do a better job in terms of counter-trafficking, in terms of combating child labor, etc. Interestingly, you know, this was in the Oficina Regional para América Latina y Caribe, the regional office of the ILO for the Latin American and the Caribbean. And interestingly, there I've issued this chart that shows the international migratory routes in Latin America. I mean, workers coming from these countries, Bolivia, Paraguay, Peru, in some cases China, Haiti, Uruguay, India, to be exploited in Brazil. So this is the result of a combination of like 8-10 data sets. For the first time we did it, just, you know, spending some weekends working in our free time to map what's going on in Latin America and in Brazil in terms of receiving workers from abroad to be exploited in Brazil. And I would like to end this presentation with 3 short stories. The first one is about Zilda Arns. She's a Brazilian pediatrician who developed a means of connecting local communities to engage in the reduction of the mortality, the infant mortality rates in Brazil. And she died unfortunately in 2013 with 75 years old in an earthquake in Haiti. But more importantly, she just using a spoon in an idea without, you know, large amounts of money, she changed the game in terms of fighting the infant mortality rates in Brazil. And what's the idea I would like to leave you with? Is that, you know, using information and data doesn't cost a lot. And there are so much information out there, so much databases out there, and this everything that I said doesn't apply only to Brazil. There are other countries in the world that can do the same thing. Mostly in the poor countries, poor and middle-income countries. So if you can read about her, it's worth it. And the second story I'd like to leave you with is, I don't know if you know this map. Who knows this map here? This is a map of London of 1854, and it represents sort of, because you all will agree that people didn't have smartphones or internet or Google or anything there. And there was a doctor called John Snow. It's not the John Snow of the Game of Thrones, okay? It's not him, okay? It's John Snow of London in 1854. They were facing a cholera outbreak, and all of a sudden he had some insights that maybe the cholera outbreak should be was probably connected to the water supply, but he didn't know how to figure his insight out. So what he did was to get a piece of paper and start to draw, the map of London, and this is Broad Street, where there is a pump over here, and this map concentrates the deaths of people who consumed water from this pump in places that were supplied by this pump. So you can see the concentration of people dying around that pump. And interestingly, he didn't have the data. He didn't have any data. He just started to collect on the fly during a cholera outbreak, and within 2 or 3 days, he managed to figure it out and to develop an intervention, which was close the pump. And he is one of the fathers of the modern epidemiology. A great story about how you can build value on the cheap, on the opportunities you already have, on the resources you already have. And that's the basic idea of Smartlab. Smartlab doesn't mean that we're smarter than other people. It means that we're mostly working with smart practices, which means that we're trying to build value on the cheap. We're looking around us to see the opportunities we already have, the people with whom we already work, and the data we already have to transform into real interventions and more impactful interventions. And the last story, I promise I will end this presentation, is, you know the story, right? It's Challenger in the 80s. I was a boy when that happened, and I remember that very well because, I remember the photo of the astronauts. It was something that I keep in my mind since I was a boy, and NASA had the best information you can imagine and didn't manage to avoid a disaster. And the NASA, the heads of NASA were alerted by 2 or 3 engineers that disaster would happen. So the fact that you have the best information available doesn't mean that you make the best decisions, but you have the opportunity to, listening to the people who knows how to interpret the data, and with humility listen to them and try to make decisions. So it's not because it's NASA. They have. I don't need NASA to solve a problem and to improve the counter-trafficking strategies. I need something, a simple solution, such as that solution that Zilda Arndt used to tackle the infant mortality in Brazil. Just a spoon that she used to show people how to prepare a solution based on salt, water, and sugar to tackle infant mortality. Well, interestingly, last slide, I guess. This is, it's not I'm not trying to make marketing for them, but this is a logo of Gartner. Gartner is one of the largest consulting firms in the world, multi-billion-dollar company. Recently, they referred to our initiative in a conference as an example of doing data, using data for good. And interestingly, lots and lots of organizations hire Gartner to try and do the same, but they spend millions of dollars and they don't manage to do basic, simple things. You know, take a look at your data, dig deep into the data sets, use your domain knowledge, try to figure out what's going on, connect to people that know that might help you to figure out what's going on. Well, next steps, we're recreating the platform, and I've used the time I've spent here at Stanford this year to redesign the whole thing. And everything that you've seen, we're transforming into a storytelling platform now. Because many frontline, many policymakers still say, I didn't understand what you mean by that chart. I mean, there's a pie there and there. So we're sort of creating text to explain, to sort of describe what's going on. And this is, for example, a chart in which we're focusing on at-risk children along Brazilian highways. So to reach the policymaker there and the police authorities, we need to explain what's going on when they should be doing that, right? Well, it's enough. Thank you very much for your attention.